Hi everyone, today we'll solve few questions. So first question is blood supply of the superior parathyroid gland. So both superior and the inferior parathyroid glands are supplied by the inferior thyroid artery. The option is B. So next question. So surgery done for thyroglossal cyst. So it is a straightforward question. So cyst trunks procedure. So what is cyst trunks procedure? So it is the procedure done to remove the remnant thyroglossal duct, which involves complete removal of the tract and the central portion of the hyoid bone. So thoracic duct drains into the junction between. So thoracic duct is nothing but a lymphatic duct, so which drains onto the left, the junction between the left subclavian and the left IJV. So left supraclavicular lymph node is also known as the Virchow's node. Some or more bodies are seen in medullary carcinoma, Hürthle cell cancer, follicular cancer and papillary. So this is a classical feature of papillary carcinoma of thyroid. So amyloid deposits are seen in medullary carcinoma of thyroid. So recurrent laryngeal nerve is always in close association with the inferior thyroid artery. The most common NET which is seen in MEN1 syndrome is gastrinoma. So hyperparathyroidism is characterized by all of the following except. So hyperparathyroidism is a condition where there is excessive production of PTH hormone, so that there is destruction of the bone, so it causes osteoporosis, and there is increased calcium excretion resulting in the renal calculi. So there are due to increased calcium, so they can also result in pain abdomen. So osteosclerosis is not seen in hyperparathyroidism. So that's the answer. Classic triad of pheochromocytoma are all of the following except. So headache is seen, sweating is seen and palpitation. So these are the three classic triad of the pheochromocytoma. Since the question is except, syncope is the answer. The most common site of ectopic pheochromocytoma is organ of Zuckerkandl. Blueberry muffin rash, this is classically seen in neuroblastoma. Intestinal obstruction with jejunal neuromas are seen in MEN2B syndrome. Common feature to MEN1 and MEN2 is hyperparathyroidism. So hyperparathyroidism is seen in both MEN1 and MEN2, whereas medullary CA thyroid is seen only in MEN2 and pheochromocytoma is also seen only in MEN2 syndrome. Carcinoids is not a part of this. Carcinoids are part of MEN1. Most common carcinoma of the thyroid is papillary. FNAC is not useful in which of the following malignancy? It is not useful in follicular because the differentiation between the follicular adenoma and follicular carcinoma is mainly by the observing capsular and vascular invasion. So that is made out only in the biopsy. The recommended age for prophylactic thyroidectomy in MEN2B syndrome is 1 year of age. The biochemical report seen in primary hypothyroidism is always primary hypothyroidism. The defect is in the thyroid gland itself. So they reduce T3, T4 is reduced. So compensatory elevation in the level of TSH by the pituitary. So option C is the correct one. Boundaries of the posterior triangle of the neck except. So sternocleidomastoid forms the anterior border. So trapezius forms the posterior border and clavicle forms the inferior border, and superior belly of homohyoid does not form any border of the posterior triangle. So that is the answer. So structure preserved in modified radical neck dissection in type 2. So here the options are 11. So sorry for the mistake, it is cranial nerve 11. The structures are usually preserved in MRND are the IJV and cranial nerve 11 and sternocleidomastoid. In type 2, we preserve only the first thing is cranial nerve 11 and next is IJV. So D is the option. Hurthle cell tumor is nothing but the follicular carcinoma of the thyroid. Tumor marker of medullary CA thyroid. Calcitonin is mainly produced by these the parafollicular C cells, and that is the cell of origin for medullary carcinoma. And CA is also elevated in these cancers, so both CA and calcitonin. The structure which divides the level 2 lymph node into 2A and 2B is spinal accessory nerve. Thyroid storm after operation is due to inadequate control of hypothyroidism. So a thyroid storm is nothing but a condition where there is excessive release of thyroid hormones suddenly into the bloodstream, causing increasing in the basal metabolic rate, increasing the heart rate, increasing the BP, and increasing the temperature of the patient. So it is not due to massive bleeding or RLN injury or postoperative infection. A 40-year-old female patient underwent total thyroidectomy and develops perioral numbness on postoperative day 2. So with facial twitching. So this sign is known as the chopstick sign. So if the question is carpopedal spasm, then it will be Troche's sign. And Homan sign is seen in DVT. Pemberton sign is due to superior vena cava compression because of retrosternal goiter. Which of the following statement about Graves' disease is false? So Graves' disease is an autoimmune disorder, so that is a correct statement, and it results in hyperthyroidism because the antibodies which are present were produced in this condition will act on the TSH receptor similar to TSH, so increasing the thyroid hormone production. So there is hyperthyroidism, and since the whole gland is affected, it is called as diffuse toxic goiter, and it's most commonly seen in females, not in males. So that is the answer. The most common cause of thyroiditis is Hashimoto's thyroiditis, most commonly seen in females. The occurrence of hyperthyroidism following administration of supplemental iodine to subject with endemic iodine deficiency goiter is known as. So there is hyperthyroidism following supplemental iodine for iodine deficiency goiter. So the effect is George-based effect. True statement of treatment of thyrotoxicosis in pregnancy. So this question is a bit tricky, so you need to identify what is the true statement. So radioiodine is contraindicated, yes. So in pregnancy, no form of radiation therapy is given, whether it is radioactive iodine or radiotherapy for any malignancy or any condition. So radiotherapy is contraindicated because it can cause fetal malignancies and early childhood malignancy, so it is not used. So this is the correct statement. Thiouracil is contraindicated, no, because PTU is the drug of choice for thyrotoxicosis in pregnancy in the first trimester. And surgery is contraindicated, no. Surgery, when the antithyroid medications are not able to control the patient's symptoms, so during second trimester the patient can undergo surgery, and it is the best option for thyrotoxicosis. So radioiodine is contraindicated. Since this is a correct statement, that is the answer. What is lateral aberrant thyroid? So the lymph node metastasis and papillary carcinoma. Certain times patient may not present with a thyroid swelling, they can present with the lymph node swelling. So whenever a patient presents with the lymph node swelling in the cervical region, always check the oral cavity and the thyroid, oral cavity, oropharynx, nasopharynx, and the thyroid, and if these are negative, then only you are going to follow up for the whole body. So the lymph node metastasis in follicular carcinoma is very rare condition. So superior parathyroid is a derivative of fourth arch, whereas the third arch gives rise to inferior parathyroid and the thymus. Most common location of ectopic inferior parathyroid gland, so it is intrathymic, that is within the thymus, because that is both thymus and inferior parathyroids are derived from the third arch. So measurement of which antibody is used for autoimmune thyroiditis. Autoimmune thyroiditis is nothing but the Hashimoto's. So this Hashimoto's thyroiditis, you have the anti-TPO antibodies which are elevated. Causes of hyperthyroidism with elevated radioiodine uptake. So this is nothing but the radioiodine uptake. Hyperthyroidism, except so Graves' disease, there is increase in the iodine uptake. Thyroiditis, there is hyperthyroidism because the inflammation causes release of thyroid hormones, but there is no increase in the production. Toxic adenoma and toxic multinodular goiter, they also result in hyperthyroidism, and there is increased activity in the thyroid gland because of for the production of more and more thyroid hormones. Iodine is taken up, so the iodine uptake will be elevated, but not in thyroiditis. Thyroiditis is nothing but the release of previously formed hormones due to inflammation. So they result in only thyroiditis with no elevated radioiodine uptake. So red proto-oncogene is present on chromosome number 10. So this is responsible for MEN2A and 2B. Rose position is nothing but you hyperextend the neck. You hyperextend the neck by placing the shoulder bags, by placing certain like sandbag or like a sandbag below the patient's shoulder, so that there is hyperextension of the neck. So this is used for tonsillectomy, thyroidectomy and tracheostomy, not a modified radical neck dissection, because where in this surgery you give 30-degree elevation with neck turned towards one side. The chin and the neck is turned towards one side. Parathyroids are auto-transplanted into. So whenever there is inadvertently removed parathyroids during the thyroid surgery because of intrathyroidal, or they were closely attached to the thyroid tumor. So in such conditions, if you isolate these parathyroids, so you mince them and you put it into the sternocleidomastoid, or if you feel there is some kind of disturbance with the sternocleidomastoid, again we cannot open the neck if there is any kind of adenoma development from that parathyroid. So you suspect such conditions and you don't want to place it in the sternocleidomastoid, you always choose non-dominant, that is non-dominant hand brachioradialis muscle. Measurement of bone mineral density in the DEXA scan. So any patients who are going for osteoporosis evaluation, so they get this DEXA scan. So that in the DEXA scan, the most commonly used are lumbar spine, the distal radius and the femur neck to assess the bone porosity along with the standards. So proximal radius is not used, so that is the answer. So investigation of choice in pheochromocytoma is MIBG scan. So it is investigation done in rather than the choice, it is done in the pheochromocytoma is MIBG scan. So left adrenal vein drains into the left renal vein, whereas the right adrenal vein directly drains into the IVC. Aldosterone is secreted by the zona glomerulosa, and zona fasciculate secretes glucocorticoids and reticularis, sex steroids, and adrenal medulla epinephrine and norepinephrine. Retrosternal goiter is most commonly operated by which route, and retrosternal goiters are usually the extension of these thyroid enlargement from the neck into the mediastinum. So they are most commonly operated to the neck. Only if there are primary mediastinal goiter, then you use sternotomy. Cernius classification is always the relationship between the superior thyroid artery and the external branch of superior laryngeal nerve. So boundaries of Behr's triangle is all of the following except. So common carotid artery forms the base, and inferior thyroid artery forms one of the arm, and recurrent laryngeal the other arm. So internal carotid artery will not form Behr's triangle. Mcqs protocol is used in parathyroidectomy. This is the protocol whenever you are removing a parathyroid adenoma or you are operating for parathyroid hyperplasia. So you use intraoperative parathyroid hormone estimation. So if there is a fall in more than 50% of PTH value than the preoperative values, so that is the point where you need to stop dissecting and leave the parathyroid hormones. Otherwise the patient will develop profound hypoparathyroidism or hypocalcemia. So cystamegaly accumulates in which structure? So it mainly accumulates in the mitochondria of the oxyphil cells of the parathyroid adenoma. Horner syndrome does not include, so it causes ptosis, anhidrosis, and it is meiosis, not mydriasis. So this is the answer, and enophthalmos. So Horner syndrome is nothing but the stellate. There is a injury to the stellate ganglion. So the sympathetic ganglion is lost. So there will be anhidrosis and meiosis. Mydriasis is the sympathetic activity, and enophthalmos and ptosis is because of the palpebral muscles which have lost the sympathetic control. After thyroidectomy, patient developed stridor within 2 hours. So all are the likely causes of stridor except. So RLN palsy, immediately yes, the patient can go for stridor because adduction of the vocal cords. And tracheomalacia, yes, when there is a long-standing large goiters compressing the trachea and causing erosion of the cartilage. So suddenly when you remove it, so there can be collapse of this tracheal cartilage, and it can obstruct the airway causing stridor, or the wound hematoma compressing the trachea can cause stridor. Hypocalcemia is usually seen after 48 hours of the surgery. So, and this is not the cause of stridor, immediate stridor within 2 hours. Thyroid biopsy of a patient showed the presence of Hürthle cells. The antibodies, so this presence of Hürthle cells is commonly seen in Hashimoto's thyroiditis, and the antibody evaluated is anti-TPO. Thyroglossal cyst may occasionally give rise to papillary carcinoma. Thank you.